Understanding Hereditary Haemochromatosis, a comprehensive guide. Table of contents. 1. Introduction to Hereditary Haemochromatosis. 2. Understanding the genetics of Hereditary Haemochromatosis. 3. Clinical features and diagnosis of Hereditary Haemochromatosis. 4. Causes and risk factors of Hereditary Haemochromatosis. 5. Complications and management of Hereditary Haemochromatosis. 6. Living with Hereditary Haemochromatosis, lifestyle changes and support. 7. Research and future directions in Hereditary Haemochromatosis. Disclaimer: this audiobook and video are for educational purposes only and are not intended as medical advice, diagnosis, or treatment. Hereditary haemochromatosis is a complex condition, and management decisions should always be made in consultation with a qualified healthcare provider. While every effort has been made to ensure the accuracy of the information presented, I cannot guarantee that all content is up to date or applicable to individual cases. The information shared here is based on current research, expert sources, and general medical understanding. However, it is not a substitute for personalized medical guidance. Viewers are encouraged to seek professional advice for specific health concerns, and not to disregard or delay seeking medical care based on information from this audiobook. I do not assume liability for any reliance on the information provided in this book or video format, nor do I endorse any products or treatments mentioned herein, unless explicitly stated. Please consult your physician or a specialist before making any changes to your healthcare regimen. Chapter 1: Introduction to Hereditary Haemochromatosis. Hereditary haemochromatosis, also known as genetic hemochromatosis, is a hereditary condition that affects how the body processes iron. This condition causes the body to absorb and store excessive amounts of iron, leading to an accumulation of iron in various organs, such as the liver, heart, pancreas, and joints. Hereditary haemochromatosis is the most common genetic disorder among people of Northern European descent, affecting approximately 1 in 200 individuals. It is usually inherited in an autosomal recessive manner, which means that an individual must inherit 2 copies of the mutated gene, one from each parent, to develop the condition. Iron is an essential mineral that is necessary for many physiological processes in the body, including the production of red blood cells. However, when the body absorbs and stores too much iron, it can lead to a buildup of iron in organs and tissues, which can cause damage over time. Hereditary haemochromatosis is caused by mutations in genes that regulate iron metabolism, particularly the HFE gene. The excess iron accumulation in hereditary haemochromatosis can lead to various clinical manifestations. The liver is often the most affected organ, with iron deposition leading to inflammation, fibrosis, and eventually cirrhosis. Other organs, such as the heart, pancreas, and joints, can also be affected, leading to symptoms such as fatigue, abdominal pain, joint pain, and skin pigmentation changes. The diagnosis of hereditary haemochromatosis involves a combination of clinical evaluation, family history, and laboratory tests to assess iron levels in the blood and other markers of iron overload. Genetic testing can also be used to identify mutations in the HFE gene or other genes associated with hereditary haemochromatosis. Managing hereditary haemochromatosis typically involves regular phlebotomy, which is the removal of blood to reduce iron levels in the body. Other management strategies may include iron chelation therapy, dietary modifications, and monitoring for complications such as cirrhosis and diabetes. Early diagnosis and appropriate management can help prevent or minimize the complications associated with hereditary haemochromatosis. In conclusion, hereditary haemochromatosis is a genetic condition that leads to excessive iron absorption and storage in the body, resulting in iron accumulation in various organs. It is the most common genetic disorder among people of Northern European descent, and is usually inherited in an autosomal recessive manner. Early diagnosis and proper management are essential in preventing or managing the complications associated with hereditary haemochromatosis. In the following chapters, we will explore the genetics, clinical features, diagnosis, risk factors, complications, and management of hereditary haemochromatosis in detail. Chapter 2: Understanding the genetics of hereditary hemochromatosis. Hereditary hemochromatosis is primarily caused by mutations in the HFE gene, which plays a crucial role in regulating the body's iron metabolism. The HFE gene is located on chromosome 6 and codes for a protein that interacts with other proteins involved in iron regulation. The most common mutations associated with hereditary hemochromatosis are C282Y and H63D. The C282Y mutation occurs in approximately 85 to 90% of cases, while the H63D mutation is less common, occurring in about 10 to 30% of cases. These mutations disrupt the normal function of the HFE protein, leading to increased iron absorption from the diet and subsequent iron overload in the body. The C282Y mutation results in a loss of function of the HFE protein, which impairs its ability to regulate the expression of a protein called hepcidin. Hepcidin is a hormone that helps control iron absorption by blocking the absorption of iron from the intestine and promoting the release of iron from cells that store it. In hereditary hemochromatosis, the loss of function of the HFE protein leads to decreased hepcidin levels, resulting in increased iron absorption from the diet and subsequent iron accumulation in organs and tissues. The H63D mutation, on the other hand, is a missense mutation, meaning that it results in a change in the amino acid sequence of the HFE protein. This mutation does not completely abolish the function of the HFE protein, but it may still disrupt its normal interactions with other proteins involved in iron metabolism, leading to increased iron absorption. It's important to note that not all individuals with C282Y or H63D mutations develop hereditary hemochromatosis. The penetrance, or the likelihood of developing the condition, is influenced by other genetic and environmental factors, and not everyone with these mutations will experience iron overload or related symptoms. Genetic testing can be performed to identify mutations in the HFE gene and confirm a diagnosis of hereditary hemochromatosis. This typically involves a blood test to detect the presence of C282Y and H63D mutations in the HFE gene. Genetic counseling may also be recommended to help individuals understand their risk of developing hereditary hemochromatosis and make informed decisions about their health. In conclusion, hereditary hemochromatosis is primarily caused by mutations in the HFE gene, with the most common mutations being C282Y and H63D. These mutations disrupt the normal function of the HFE protein, leading to increased iron absorption from the diet and subsequent iron overload in the body. Genetic testing can be used to identify these mutations and confirm a diagnosis of hereditary hemochromatosis, but other factors may also influence the penetrance of the condition. Chapter 3: Clinical Features and Diagnosis of Hereditary Hemochromatosis. Hereditary hemochromatosis can present with a wide range of clinical features, and the symptoms can vary widely among affected individuals. The condition is often referred to as a silent disease because it may not cause noticeable symptoms in the early stages. However, as iron accumulates in organs and tissues, hereditary hemochromatosis can lead to various complications. Early symptoms of hereditary hemochromatosis may include fatigue, weakness, joint pain, and abdominal pain. These symptoms are often nonspecific and can be mistaken for other conditions. As the condition progresses, it can lead to more serious complications, such as cirrhosis of the liver, diabetes, heart disease, and arthritis. Liver cirrhosis may cause symptoms such as jaundice, yellowing of the skin and eyes, fluid retention in the abdomen, ascites, and mental confusion, hepatic encephalopathy. Diabetes can cause increased thirst, frequent urination, and blurred vision. Heart disease may manifest as chest pain, palpitations, or shortness of breath. Arthritis may cause joint pain, swelling, and stiffness. Diagnosis of hereditary hemochromatosis typically involves a combination of clinical evaluation, family history assessment, blood tests, and genetic testing. A thorough clinical evaluation may include a review of the patient's medical history, a physical examination, and assessment of signs and symptoms associated with iron overload. Family history is an important aspect of diagnosing hereditary hemochromatosis, as the condition is inherited in an autosomal recessive manner. A family history of hereditary hemochromatosis or unexplained liver disease may raise suspicion for the condition. Blood tests are commonly used to assess iron levels and liver function. Serum iron, transferrin saturation, TSAT, and ferritin levels are often measured. Increased levels of serum iron and TSAT, along with elevated ferritin levels, may suggest iron overload. Liver function tests, such as alanine aminotransferase, ALT, and aspartate aminotransferase, AST, may also be performed to assess liver health. Genetic testing can confirm a diagnosis of hereditary hemochromatosis by identifying mutations in the HFE gene, particularly the C282Y and H63D mutations. Genetic testing is typically done through a blood sample or saliva sample, and it can help determine if an individual has inherited 1 or 2 copies of the mutated gene. Early diagnosis of hereditary hemochromatosis is crucial to prevent or manage complications associated with iron overload. Treatment options include therapeutic phlebotomy, which involves regular removal of blood to reduce iron levels, and lifestyle changes such as dietary modifications to reduce iron intake. Early intervention can help prevent or manage complications and improve the quality of life for individuals with hereditary hemochromatosis. In conclusion, hereditary hemochromatosis can present with a wide range of clinical features, and early symptoms may include fatigue, weakness, joint pain, and abdominal pain. Diagnosis of hereditary hemochromatosis typically involves a combination of clinical evaluation, family history assessment, blood tests to measure iron levels and assess liver function, and genetic testing to identify HFE gene mutations. Early diagnosis is crucial to prevent or manage complications associated with iron overload. Chapter 4: Causes and Risk Factors of Hereditary Hemochromatosis. Hereditary hemochromatosis is primarily caused by mutations in the HFE gene, which is responsible for regulating the body's iron absorption. Mutations in the HFE gene disrupt the normal function of the HFE protein, leading to increased iron absorption from the diet and subsequent iron overload in the body. The most common mutations associated with hereditary hemochromatosis are C282Y and H63D, although other mutations can also be implicated. Inheritance of mutated HFE genes from both parents is the primary cause of hereditary hemochromatosis. The condition is inherited in an autosomal recessive manner, which means that an individual must inherit 2 copies of the mutated gene, one from each parent, to develop hereditary hemochromatosis. If an individual inherits only one mutated gene, they are considered a carrier and usually do not develop symptoms of the condition. However, carriers may still have increased iron levels and are at risk of passing the mutated gene to their children. In addition to genetic mutations, there are other risk factors that can influence the development and severity of hereditary hemochromatosis. Gender is one such risk factor, as men are more likely than women to develop symptoms of the condition. This is because women tend to lose iron through menstruation and childbirth, which helps to regulate their iron levels. Men, on the other hand, do not have a similar mechanism for iron loss, and therefore may be at higher risk of iron overload. Age is another risk factor for hereditary hemochromatosis, as the condition typically manifests between the ages of 30 and 50. However, symptoms may not appear until later in life, as iron accumulation in the body occurs gradually over time. Regular monitoring of iron levels through blood tests may be recommended for individuals with a family history of hereditary hemochromatosis, especially as they age, to detect any signs of iron overload early. Alcohol consumption is also a risk factor for hereditary hemochromatosis. Excessive alcohol consumption can exacerbate iron overload and increase the risk of developing complications associated with the condition. Alcohol can interfere with the normal regulation of iron absorption in the body, leading to increased iron accumulation. Therefore, individuals with hereditary hemochromatosis are often advised to limit or avoid alcohol consumption to help manage their iron levels. In conclusion, the primary cause of hereditary hemochromatosis is the inheritance of mutated HFE genes from both parents. Other risk factors such as gender, age, and alcohol consumption can also influence the development and severity of the condition. Men are more likely than women to develop symptoms of hereditary hemochromatosis, and the condition typically manifests between the ages of 30 and 50. Excessive alcohol consumption can exacerbate iron overload and increase the risk of developing complications. Regular monitoring of iron levels and lifestyle modifications may be recommended for individuals with hereditary hemochromatosis to manage the condition effectively. Chapter 5: Complications and Management of Hereditary Hemochromatosis. Hereditary hemochromatosis, if left untreated, can result in serious complications due to iron overload in the body. Excess iron can accumulate in various organs, such as the liver, heart, pancreas, and joints, leading to a range of complications. However, with proper management, the complications associated with hereditary hemochromatosis can be prevented or minimized. One of the most common complications of hereditary hemochromatosis is liver disease, including cirrhosis. Iron accumulation in the liver can cause inflammation and damage to liver cells over time, leading to cirrhosis, which is the scarring of the liver tissue. Cirrhosis can disrupt the normal functioning of the liver and may progress to liver failure if not managed promptly. Another complication of hereditary hemochromatosis is heart disease. Excess iron can accumulate in the heart muscle, leading to cardiomyopathy, which is a condition that weakens and enlarges the heart. This can impair the heart's ability to pump blood efficiently and may result in heart failure. Pancreatic damage is also a possible complication of hereditary hemochromatosis. Iron deposition in the pancreas can interfere with its ability to produce insulin, which is a hormone that regulates blood sugar levels. This can lead to diabetes mellitus, a condition characterized by high blood sugar levels. Other complications of hereditary hemochromatosis may include joint pain and arthritis. Iron accumulation in the joints can cause inflammation, pain, and damage to cartilage, leading to joint problems and limited mobility. Management of hereditary hemochromatosis involves reducing excess iron levels in the body to prevent or manage complications. The most common method of managing hereditary hemochromatosis is through phlebotomy, which is the process of removing blood from the body to lower iron levels. Phlebotomy is typically performed regularly, initially more frequently, and then less often as iron levels decrease, to maintain optimal iron levels in the body. The frequency and duration of phlebotomy treatment may vary depending on the severity of the iron overload and the individual's response to treatment. In addition to phlebotomy, dietary modifications may also be recommended. A diet low in iron, particularly avoiding iron supplements and iron-rich foods, may help reduce iron absorption from the diet and prevent further iron accumulation in the body. Regular monitoring of iron levels through blood tests may also be necessary to assess the effectiveness of treatment and adjust the management plan accordingly. Genetic counseling and testing are also important aspects of managing hereditary hemochromatosis. Genetic testing can confirm the diagnosis and identify the specific HFE gene mutations responsible for the condition. Genetic counseling can provide information about the risks of passing the mutated gene to offspring and help individuals make informed decisions about family planning. In conclusion, hereditary hemochromatosis can lead to serious complications if left untreated. However, with proper management, including phlebotomy, dietary modifications, regular monitoring of iron levels, and genetic counseling, the complications associated with hereditary hemochromatosis can be prevented or minimized. It is important for individuals with hereditary hemochromatosis to work closely with their healthcare team to develop an individualized management plan to effectively manage the condition and maintain good health. Chapter 6: Living with Hereditary Hemochromatosis, Lifestyle Changes and Support. Introduction. Living with hereditary hemochromatosis requires making certain lifestyle changes and seeking appropriate support to effectively manage the condition. This chapter will discuss the importance of these changes and the impact of hereditary hemochromatosis on daily life. 2. Lifestyle changes. Dietary modifications to reduce iron intake. Avoidance of iron-rich foods and supplements. Individuals with hereditary hemochromatosis need to be mindful of their iron intake and avoid foods that are high in iron, such as red meat, liver, fortified cereals, and iron supplements. Importance of reading food labels and understanding iron content. reading food labels can help individuals with hereditary hemochromatosis make informed choices about their diet and choose foods that are low in iron. B. Limiting alcohol consumption. Alcohol's impact on iron absorption and liver health. Excessive alcohol consumption can exacerbate iron overload and contribute to liver damage in individuals with hereditary hemochromatosis. Recommended guidelines for alcohol consumption. It is important for individuals with hereditary hemochromatosis to follow recommended guidelines for alcohol consumption, which may include abstaining from alcohol or limiting intake to moderate levels as advised by their healthcare provider. C. Regular exercise and weight management. Benefits of exercise in managing iron levels and overall health. Regular exercise can help manage iron levels and improve overall health in individuals with hereditary hemochromatosis. Weight management is also important as obesity can worsen iron overload. Appropriate exercise and weight management strategies for individuals with hereditary hemochromatosis. Individuals with hereditary hemochromatosis should work with their healthcare provider to develop an exercise and weight management plan that is suitable for their individual needs and health condition. 3. Managing symptoms and complications. A. Pain management strategies for joint pain and arthritis. Medications, physical therapy, and other interventions. Joint pain and arthritis are common symptoms of hereditary hemochromatosis. Pain management strategies may include medications such as nonsteroidal anti-inflammatory drugs, NSAIDs, physical therapy, and other interventions as recommended by healthcare providers. B. Managing fatigue and weakness. Rest and relaxation techniques. Fatigue and weakness can be debilitating symptoms of hereditary hemochromatosis. Rest and relaxation techniques such as adequate sleep, stress management, and pacing oneself can help manage these symptoms. C. Coping with emotional and psychological aspects. Dealing with anxiety, depression, and stress. The impact of hereditary hemochromatosis goes beyond physical symptoms and may also affect an individual's emotional well-being. Coping strategies may include seeking support from friends, family, or mental health professionals, and utilizing stress management techniques such as mindfulness, meditation, or counseling. 4. Supportive care. A. Regular monitoring and follow-up with healthcare providers. Blood tests to monitor iron levels and liver function. Regular monitoring of iron levels and liver function through blood tests is important in managing hereditary hemochromatosis. Healthcare providers may adjust the treatment plan as needed based on the results. B. Genetic counseling and family planning. Understanding risks of passing on the mutated gene to offspring. Individuals with hereditary hemochromatosis may need genetic counseling to understand the risks of passing on the mutated gene to their offspring. Making informed decisions about family planning. Genetic counseling can help individuals with hereditary hemochromatosis make informed decisions about family planning, including options such as prenatal testing, adoption, or assisted reproductive techniques. C. Support groups and resources. Connecting with other individuals with hereditary hemochromatosis, joining support groups or online communities can provide a valuable source of emotional support, shared experiences, and practical tips for living with hereditary hemochromatosis. Additionally, accessing reputable resources such as educational websites, patient advocacy organizations, and informational materials can provide valuable information and guidance for managing the condition effectively. V. Conclusion. Living with hereditary hemochromatosis requires making important lifestyle changes and seeking appropriate support to effectively manage the condition. By making dietary modifications, limiting alcohol consumption, engaging in regular exercise and weight management, managing symptoms and complications, and utilizing supportive care including regular monitoring, genetic counseling, and accessing support groups and resources, individuals with hereditary hemochromatosis can lead a healthy and fulfilling life. It is important to work closely with healthcare providers and utilize available resources to effectively manage the condition and maintain optimal health and well-being. Chapter 7. Research and Future Directions in Hereditary Hemochromatosis. Introduction. Hereditary hemochromatosis is a complex condition with various genetic and environmental factors influencing its development and progression. Research plays a crucial role in advancing our understanding of the disease and improving its management. In this chapter, we will explore the current research landscape, identify gaps in knowledge, and discuss potential future directions in hereditary hemochromatosis research. 2. Genetic research. Genetic mutations in the HFE gene are known to be the primary cause of hereditary hemochromatosis. However, research continues to explore other genes and mutations that may contribute to the development and severity of the disease. Identifying genetic modifiers and understanding their role in disease progression could provide valuable insights into predicting disease outcomes and tailoring treatment approaches. Advancements in genetic testing techniques and personalized medicine have the potential to revolutionize the diagnosis and management of hereditary hemochromatosis. 3. Pathophysiology research. Understanding the underlying mechanisms of iron absorption and regulation is critical in managing hereditary hemochromatosis. Research continues to elucidate the role of hepcidin, a hormone that regulates iron metabolism, and other proteins involved in iron homeostasis. Exploring novel therapeutic targets, such as hepcidin agonists or inhibitors, may offer new treatment strategies for controlling iron overload. 4. Clinical research. Clinical research plays a vital role in evaluating risk factors, predictors of disease progression, and treatment outcomes in hereditary hemochromatosis. Identifying early predictors of disease severity and progression could help in developing targeted interventions to prevent or delay complications. Clinical trials investigating the safety and efficacy of different treatment strategies, such as phlebotomy, iron chelation, or other emerging therapies, are ongoing and can provide valuable evidence to guide clinical practice. Emerging therapies research is also focused on developing novel therapies for hereditary hemochromatosis. Gene therapy, RNA-based therapies, and other innovative approaches are being explored as potential future treatments for hereditary hemochromatosis. Gene therapy involves correcting or replacing the faulty gene responsible for the disease, offering a potential curative approach. RNA-based therapies, such as antisense oligonucleotides or small interfering RNA (siRNA), can target and degrade specific RNA molecules involved in iron metabolism, offering a more targeted and precise therapeutic approach. Other innovative approaches being investigated include iron chelation therapies using novel chelators, which are molecules that bind to excess iron and facilitate its removal from the body. Newer chelators may offer improved efficacy, safety, and convenience compared to current standard of care chelators. Additionally, modulating gut iron absorption through the use of iron absorption inhibitors or enhancers is being explored as a potential therapeutic approach. 6. Patient-centered research in hereditary hemochromatosis is increasingly focusing on patient-centered outcomes, including understanding the impact of the disease on patients' quality of life, mental health, and overall well-being. Patient perspectives and experiences are being incorporated into research design, treatment decision-making, and development of patient-reported outcome measures. Engaging patients in research through patient advocacy groups, patient registries, and participatory research approaches can help ensure that research efforts are patient-centric and address the real-world needs of individuals living with hereditary hemochromatosis. 7. Future directions. As research in hereditary hemochromatosis continues to progress, several promising areas of future research are emerging. These may include further exploration of genetic modifiers and their impact on disease severity, development of more targeted and precise therapies based on personalized medicine approaches, and incorporation of multiomics data, such as genomics, transcriptomics, proteomics, and metabolomics, to better understand the complex interactions involved in iron metabolism and regulation. Additionally, exploring the potential role of gut microbiome in hereditary hemochromatosis and its impact on disease outcomes may open up new avenues for research and therapeutic interventions. 8. Conclusion. Research in hereditary hemochromatosis is rapidly evolving and has the potential to significantly impact the diagnosis, management, and outcomes of individuals with this condition. Advancements in genetic research, pathophysiology research, clinical research, emerging therapies, and patient-centered research are driving the field forward. Future research directions may further enhance our understanding of the disease and lead to novel therapeutic approaches. Continued research efforts in collaboration with patients, clinicians, and researchers are crucial in advancing the field and improving the lives of individuals with hereditary hemochromatosis. In conclusion, research in hereditary hemochromatosis is multifaceted, encompassing genetic, pathophysiological, clinical, and patient-centered aspects. Emerging therapies hold promise for more effective and precise treatments, and patient perspectives play a pivotal role in shaping research and clinical practice. Future research directions are likely to build upon the current knowledge base and address the evolving needs of individuals with hereditary hemochromatosis.